When first learning about heart blocks, it can be challenging to remember the different intervals and which block is which. Well, as always on EasyMed, we like to present things easily, and we like to provide you with simple ways to remember the content. So if you remember this jingle, this will help you remember the basic concepts for each of the different heart blocks. This will help you on EKGs, it'll help you on examinations, it'll help you practically. So if the R is far from the P, then it must be a first degree. If PR gets longer than a QRS drop, then it must be a type 1 Wenckebach. If PR stays normal and QRS quits, then it must be a type 2 Mobitz. If P and QRS beat independently, then it must be a complete third degree. We're going to briefly go through each of these individually, and this will help clarify the rhyme. So in a first degree heart block, this is when the PR interval is prolonged, greater than 200 milliseconds. So if the R is far from the P, then it must be a first degree. There are two types of second degree heart blocks, Mobitz type 1 and Mobitz type 2. The type 1 is also called Wenckebach. This is when the PR interval progressively gets longer until there is a QRS drop. So if PR gets longer than a QRS drop, then it must be a type 1 Wenckebach. The second type of a second degree heart block is when there's no change in the PR interval, but the QRS randomly drops. If PR stays normal and QRS quits, then it must be a type 2 Mobitz. And the final heart block is a complete third degree heart block. This is when the atria and ventricles are beating independently of one another. So the P waves are in their own rhythm and the QRS waves are independently in their own rhythm. If P and QRS beat independently, then it must be a complete third degree.